Hey, this is Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about compromised Overjet or Class 2 cases. I just did a video that should be posted right about the same time on my YouTube about compromised Class 3 or underbite cases. So make sure you watch that one too. But let's talk about Overjet. Let's talk about, should you take them as compromised? Should you make them perfect? What's the options? And again, similar intro than what I did with the class 3 patient. First thing I'm going to do is find out if this patient is still growing. We're going to dig into the pubertal growth spurt. We're going to dig into all kind of stuff like that. I have a lot of videos on that, so if you want to know more about that and hand wrist analysis, feel free to message us or email us and we'll be glad to send you those videos. But remember, girls can stop growing at 8, 9, 10. Boys can stop growing at 15, 16, 17. I mean, those are the outliers, but somewhere in between 8 and 17, you might still have growth. So unless the patient is 18 and up, you got to consider there might still be growth and you need to at least try. If the patient is under 18, I think it's below standard of care. Again, this is my opinion. Whether or not an insurance company or a dental board will have the same opinion, not sure. But if you stick with my opinion, you're going to be in the safer zone. For me, anyone under 18, compromise is below standard of care. You may still have the potential for growth. At the very least, you need to investigate and make sure there's no growth anymore by doing your due diligence, doing what research you need to do, getting a growth chart from the pediatrician, getting hand wrist x-ray, asking those questions. If 100% there's no more growth, okay, then you're in a gray area. You can ask the parents and you can ask the patient and go over the options. But if there's growth, you should not be jumping into taking out premolars. That's just what I'm trying to say. No way below standard of care, 100%. You need to do what's right, and that's not right. All right, so for the purpose of making things simple in this video, let's talk about a hypothetical situation where the patient is over 18, so that way they can make their own decisions and there's no growth, clearly, if they're over 18. Now what? We've got Overjet. What do we do? Well, first thing I'm going to do is ask the patient their chief complaint. If they're saying their chief complaint is that their lips are too far forward and they feel like they can't close their lips over their teeth and they're having difficulty eating and speaking, well, then I'm going to maybe lean towards more of distalization or retracting the maxillary front segment somehow. There's lots of different ways to do that. Whereas, if the patient's chief complaint is my lower jaw is too small, well, that's a different situation, right? And even in growing patients, you still need to look at that. You're going to get your SAF, you're going to get your SAF numbers, you're going to take the chief complaint, you're going to look at the profile. And what the patient thinks they may want may harm the profile. It may harm the way their face looks. It may age them as they get older. They may hate it. So again, one of the biggest things that can get you into trouble is not fully explaining the risks, benefits, and alternatives to the patient. And of course, 20 years ago when I was in ortho residency, everyone that had Overjet, we took 2 upper buys out on that. Now we don't do that, not at all. No. We're going to do our best to do other things. And that's very much a last resort because we don't know yet if this is going to compromise the airway. It maybe does, maybe it doesn't, And even if that's the last resort, you need to be digging into the airway and finding out, do they have sleep apnea? Do a screening. And if you get red flags, don't jump into doing this type of ortho. You want to send them for an OSA screening, send them to an ENT, do what you need to do to make sure you're doing the right thing for this patient. Okay, so again, what are our options? Options could be distalization of the whole upper arch, which is very easy to do with Invisalign, by the way. I think it's way easier than doing it in braces if there's no third molars impacted or present. Without third molars, they need to be gone because you can't, the more you have to push against and there's no space to put it, right? If third molars are extracted, not present, not erupted, not impacted, you can probably distalize the upper segment, Invisalign's very easy to do that. There's also all kinds of mousetraps and contraptions and carriers and whatever you can do as well if you want to do braces or if you want to do in-house. But in any case, that's one option. Of course, taking out upper buys is an option. Of course, doing anterior IPR is an option, or IPR on the maxillary arch. If it's a child and they're still growing, you can advance the mandible. You can use Invisalign MA, you can use a twin block, you can use a bionator. There's a lot of different appliances that you can use to help encourage growth of the mandible. So you really got to get all your information. You got to really put it all together, come up with the options, and guide the patient and the parent as to the right thing to do for this patient that doesn't compromise the airway, that doesn't age them, that doesn't compromise their facial features, and correct it the right way. And again, if you don't feel right about something, or if it's making you not sleep well at night, if in the pit of your stomach you know this is the wrong thing to do, even though the patient is pressuring you, don't do it. Refer the patient out. Just say, sorry, I just can't do that. Don't let patients bully you into doing things that you know aren't right, because later it's going to come back to haunt you if you have to defend it. And you'd be surprised how often these cases are going to start coming up in the next 10, 20, 30 years because people are rushing to pull out teeth. So anyways, that is my lecture on being really careful about compromised overjet cases. Although I think it's less risky than a compromised negative overjet or underbite or class 3 case. For the most part, having a little overjet is probably not gonna kill you. So it's probably fine. All right, thanks so much.